Hi everybody, Dr. Anjana Bana here and welcome back to my YouTube channel. We've spoken about it before, but we've just spoken about it and I'm so grateful to our patient Michelle for letting us share her journey. She's been on the YouTube channel before with PRF treatment, and Michelle, you recently also had a PRF, so and we are going to be doing a Cosmelan Peel, which is actually the gold standard depigmenting protocol worldwide. So we call it a peel, but it's not a peel, it's a program. It's a two-phase program that requires quite a bit of discipline to carry out, and that's why a patient like Michelle is an excellent candidate for it, because she is so good with her skincare, with her treatments, and really wants the treatment to be a success. And if you are someone that has a concern with epidermal melasma, which is a hormonal pigmentation, often after pregnancy or after you're 40, sun damage, and even post-inflammatory hyperpigmentation, this is the treatment for you. It's the ultimate treatment. And melasma is a chronic condition, so it is like a continuous battle to try and keep it at bay, but we found that we've got really fantastic results with this, as well as the home care. So while I'm doing the peel, I'll talk about it a little bit, but it's we have a lot of depigmenting protocols or hyperpigmentation treatments at the practice, but this is the one for when you've tried a lot of things, especially elsewhere, you've got epidermal melasma or very severe post-inflammatory hyperpigmentation, you can get an excellent result. A bonus to this, because it's a peel and a very stimulating peel, you get amazing collagen production. So tightening of the pores, smoothing of your lines. So it enhances, if you've had biostimulators, it really enhances those sort of treatments. So it's quite a bonus. So I'm going to cleanse. We're going to use like an active peptide cleanser for Michelle. Then we're going to degrease, and then we're going to apply the peel. Besides Michelle being like emotionally and mentally ready for a treatment like this, because it is an intense treatment, it does take a lot of commitment. There is peeling. You do look a bit red and puffy and for a few days. Besides that, physically, Michelle is also well prepared. So years of using prescription retinoids. Also, she has some active skincare already, using some depigmenting skin care, and you can see, I mean, a fantastic skin quality as well from like PRF biostimulators. So really like almost the perfect candidate for a treatment like this. I was at the AAAM, so I was doing a lecture on what was radio frequency, and I kept on saying skin prep, and one of the doctors there, and now you must remember they are very new to aesthetics, so we take it for granted because our patients know what skin prep is. We talk about it all the time. What is skin prep? What are you talking about? She asked, what is skin prep? So like stopped me dead in my tracks. I was like, how to explain this thing? So having your skin in a good place, that the inflammation is reduced, tyrosinase inhibited. So when we do treatments like this, you get a good result with very low complications, and like a faster results, less peeling. And what that means is your skincare barrier is intact. You've been using things that are already tyrosinase inhibitors, like the prescription retinoids, cysteamine, that Michelle has been using, a good sunscreen. So she's very diligent with a sunscreen use. That is really important with a treatment like this. So that is skin prep. And if you okay, and people haven't been prepping for years or haven't had good skin care for years. So for patients that are just starting on that journey, we prep them for at least 4 to 6 weeks prior to having a peel like this.
I'm not a fan of peels, but it's also...
Now you're doing it, yes, Michelle is not a fan of peels, but you're doing the ultimate peel that we have, but it's, I know why. I mean, it does a lot of stimulating treatments.
No, I know, that's why I choose this time.
Yeah.
I know I'm not gonna be, I can afford not to go out.
And it's not like you can't live your life if you do this peel. It's just the first week is a bit of a challenge, but after that people go on picnics and all of that. So yes, like I was saying, it doesn't mean you can't live your life, but yeah, the first week, and then after that people go on picnics. They just have to, you know, they ask us, listen, I'm going on a picnic, a family picnic, what can I do? Then maybe the day before you don't use your Cosmelan 2 cream, or you make sure we give them we've got tiny little samples of, it's another sunscreen, but you know, we give them samples that they can carry with to the picnic. And they, you know, we even have those sun visors. We've actually had them for years. It's like hectic sun visors, or you can get a sun visor online, a big hat. So you can go out, you can have fun. You just have to be mindful when you're doing it with this peel. So before, this is the newly formulated Cosmelan. So to reduce inflammation post peel, it's been newly formulated, and it doesn't, before it was 8 to 10 hours, now it's a 6 hour. And then afterwards at home, you just use like a lukewarm water to wash it off. You keep it moist with the spritz while you still have it on. And Michelle's hair is always absolutely beautiful when she comes here, but I go into the hairline, you know, for blending. I see a lot of people don't, and I think it's important that you don't stop here. And then we take what's left and we massage it into the areas that need it the most. So that would be the cheek area. So just important, this works exceptionally well on epidermal melasma, but dermal melasma might need more, more intense treatments, other modalities. You know, they even use dermal remodeling, that's using biostimulators, senolytics, that's like, supplements that kill off zombie cells. We actually have some videos on that also to help with dermal melasma. Using tyrosinase inhibitors that are injected in, laser therapy, polynucleotides, so lots of different options. And you can see the layer is the thickest around the cheek. And it's important that while you're on this protocol, not to use anything else. And I feel like that's the important part. Like I said, it's not just a peel, it's a program, it's a journey. So the first thing we've got here is the anti-stress mask. We use this mask in a lot of our normal post-peel procedures. It's got Zika in it, it's got lactobacillus ferment, it's got all these like rosemary extract, it's got vitamin C, it's got so many ingredients for calming and lowering inflammation in the skin. It's actually calming after a peel like this. And then in the pack, so not everybody takes this, it's fine, but Michelle has a particularly sensitive skin. She generally does go quite red post-treatment normally, so that's why we recommend the anti-stress mask. And then for the first week, that's all you do for the first week, is anti-stress mask, something called Cosmelan Recovery. It's a balm that just soothes the skin, keeps it moisturized, especially with peeling. And like I was telling her before, you get, especially, this is what I've noticed, patients of color that do the Cosmelan peel around the mouth, peels quite a bit, and it's a very sensitive area for us, very prone to post-inflammatory hyperpigmentation. That's why to keep very, very moisturized. And then a very, very potent sunscreen. So it's an SPF 50. It's got like the visible light, UVA, broad spectrum UVA, UVB, infrared. So it's like a full spectrum sunscreen that needs to be used. And then after the week, so you've peeled, you kind of restoring your skincare barrier. Then there's this. It's called Cosmelan 2. It's like a mini version of the peel, like 20% less potent ingredients, but basically it's like using I don't want to say weaker, it's still pretty potent version of the peel on your face on a daily basis, 2 to 3 times a day. Europe is 3 times. Most of our patients do it twice a day, and sometimes they start with once a day, get used to it, and then move on to twice a day. It's got a lot of tyrosinase inhibitors, azelaic acid, phytic acid, kojic acid, niacinamide. It's got a retinoid in it, so you will peel a little bit with this Cosmelan 2 initially, and then very, very little is used. You use like a pea-size amount. So we often say the end of a teaspoon. You just like take the end of a teaspoon, or we demonstrate using our pinkies, and then some people use it straight on, especially if the melasma is very severe. But to start off, you can also mix with Cosmelan Recovery. So that is the Cosmelan peel, and then this carries on for about 6 to 8 months, and then we advise the patient along the way if there's some sort of injectable treatment they'd like to do, at what stage, how and when to adjust their home care if they're going on holiday. So it's very, very doable. So if you have any questions on the Cosmelan protocol, the Cosmelan peel, I'd love to answer them. You can drop them in the comments below. You can WhatsApp us as well. Ask us on Instagram and TikTok, and remember to like and share with anyone who has hyperpigmentation, and subscribe. Bye.